Now, we've had rain and freezing temperatures for most of this week, but warming centers like the one here at Metro Hall don't usually open unless an extreme cold weather alert is called or city staff deem the weather bad enough. Now, some Toronto City Councillors on the Board of Health are hoping to change that and make warming centers more available and accessible.
The city's extreme cold weather alert policy actually only triggers the opening of warming centers when the temperature dips below -15 degrees. And this is actually forcing people to put their safety, their lives, and their health at risk because studies are showing that 72% of hypothermia cases amongst people who are experiencing homelessness actually occur when the temperature is warmer than -15 degrees.
An extreme weather event isn't the only threat to people's health. Right? People are losing toes, people are frostbitten, people are dying on the street.
Councillors Alejandra Bravo and Asma Malik, along with Councillor Gord Perks, will be requesting a review of the city's policies around warming centres at this month's Board of Health meeting.
This is something to be able to make sure that we are actually being proactive when we know a storm is coming, when we know inclement weather is coming, when we know conditions like, there's going to be rain and then a temperature drop, that we can actually work ahead of that to ensure that people have the information to be able to be safe.
Apart from the -15 threshold, city staff can also open warming centres based on weather conditions, but
the thing is that we don't know when that's going to happen. And so we've been trying to find out really what the triggers are, what the mechanisms are. If it's hard for us to figure out when, where, and for how long a warming center is going to open, how is a person who is living on the street going to find out? And so the predictability of knowing that there is a place to go and knowing where that place is and for how long it's going to be open is really crucial.
It's something workers and advocates in the sector have long been calling for.
Warming centers really just need to be open 24/7, especially in the wintertime, because people need to know that they're open. People need to be able to plan for their safety.
The issue is a long-standing one in Toronto, so the question is, why aren't warming centers more accessible?
The answer is in the 2015 report that shelter staff produce, which says that yes, we should have warming centers open 24 hours all of January and February when we know it's going to be coldest. And the reason it wasn't done at that time is funding. So absolutely, we need to make sure that we're spending every available dollar of the city's money, pushing for the matching or even greater contributions from the provincial government, who needs to step in, and also the federal government.
We just need warm spaces for people to go. And that is why we're seeing more people ride transit to stay warm. We're seeing people find respite at Union Station or in the malls or in food courts or coffee shops around the city.
So much money is being spent, policing money is being spent on policing homeless people because they're in places that they're not wanted, that we should really think about recovering that cost and investing it in a place where people can find a safe roof over their heads.
Now, the Board of Health will be meeting on Jan 16th, and they hope to have a review of warming centre policies by their next meeting in Feb. The councillors tell me they hope to implement changes as soon as possible for the remainder of the winter season. For City News, I'm Dilshad Burman.